Hello, I'm Dr. Sankeerth Vijayakumar, a consultant dermatologist and cosmetologist at Dermaville Skin Clinic, HSR Layout, Bangalore. Acne is one of the most common inflammatory conditions affecting an individual, and the most common sequele of acne is acne scars. Acne scars occur as a result of damage to the skin caused by the inflammation of the acne. Acne scars tend to affect an individual deeply, whereby he loses his self-esteem in terms of his appearance in public life. There are many different types of acne scars morphologically. They are the flat pigmented macular scars, the deep ice pick scars, you have the rolling scars, the box type scars, as well as the hypertrophic scars. The treatment modality of acne scars depends upon the type of scars. The most common procedures which we perform for acne scars are, starting from the basic one, chemical peels. Chemical peels are particularly useful for macular pigmented acne scars. The most common compounds which we use for treating acne scars are the glycolic acid, salicylic acid, tricholoroacetic acid, retinol, as well as combination peels. Multiple sessions would be required to get the desired results. Nextly, we recommend microdermabrasion. It involves the use of aluminium hydroxide crystals along with a vacuum mechanism. This aluminium hydroxide crystals brings about a superficial ablation of the skin, thereby providing for a rejuvenated look, and also helps to a certain degree in stimulating collagen. All these play a very important role in helping improving the appearance of acne scars. Thirdly, microneedling treatments, popularly known as dermaroller treatments. The basic principle of these treatments is mechanical trauma. When we induce a mechanical trauma with the help of a dermaroller, it stimulates collagen remodeling, thereby helping to improve the appearance of the scars. Next is microneedling radiofrequency. It's a slight modification and improvement over the microneedling dermaroller treatments. Apart from the mechanical trauma, it also has a thermal component. Now, a combination of the mechanical trauma as well as the thermal component acts as a potent stimulator for collagen synthesis, and this gives much better results than the dermaroller treatment alone. The results are almost comparable to that of lasers, and the advantage of this procedure is that there is virtually no downtime, and the patients can resume their work immediately the same day or the next day as well. Coming to the lasers, lasers have been in the forefront in the treatment of acne scars, particularly carbon dioxide laser as well as the erbium YAG lasers. Lasers provide for excellent results, but one must always remember that there is a downtime of about 5 to 6 days associated with lasers. A couple of other procedures which we perform for acne scars are subcision, punch flotation, punch excision, as well as dermal grafting. To watch more videos of me, please subscribe to the Doctor's Circle.